We requested the help of the EU Health Task Force for the help of executing an after-action review for the management of COVID-19 pandemic in our country. Once the National Institute of Public Health was requested by the Ministry of Health to perform an analysis of the management of the pandemic in Slovenia, we discussed first informally within the institute, and then discovered that neither do we have the human resources, neither do we have a sufficient experience in executing or organizing after-action reviews that we could do it ourselves. Plus, there's also the somewhat of a sensibility to the COVID-19 pandemic in general, that it would be nice to have some kind of a neutral party to actually contribute to the after-action review. We then presented this fact to our management team at the National Institute, and hence decided to request ECDC or the EU Health Task Force for their help. From start to finish, the experience was very much positive. The team that was established at the ECDC for helping us with the AAR were adequately chosen experts in the areas that we decided to evaluate, to review. So their accessibility, their help with any kind of advice that we needed, their help with the execution of the AAR itself, and last but not least, their help with the report writing and preparations has been all of the above positive. In my opinion, the benefits were several. First, there was the knowledge gained through the experience with the EU Health Task Force on the after-action reviews in general, on the execution of after-action reviews, on the arguments on how to choose areas, how to choose time frames, and everything to perform a proper after-action review. We did organize in our institute internally quite a big team that actually helped with the organizing and with the execution, so that we could have more people that would then have this knowledge around after-action reviews if we decided that we needed more of them in the future. That was one. Another one was that we actually did execute another after-action review internally at our institute, and that was for the response to the floods that happened in August 2023 in Slovenia. Massive floods happened, and that's why we actually decided to activate our emergency operating center that we have established in the past year and a half. However, it has not yet been established in total, so we don't have it completely established yet. We still decided to activate it. So once the activation was cancelled, once the EOC was deactivated, we decided to perform an after-action review, just so we could see what was good, what we did good, so which SOPs are good for the activation, which we could improve, and all of the things that come with it. Another thing is that we've been noticing in the past weeks that some of other or outside stakeholders in Slovenia have been commenting in different media about the fact that there hasn't been any analysis on the management of COVID pandemic performed in Slovenia. So this way we do have an answer for them that there has been, we did it. However, we're still waiting for the report to be finished, which brings me to actually my last point of the benefits, is that we are happily gonna publish the joint report with the ECDC because we think that it will have more of a weight when presenting the facts and the conclusions to stakeholders and even decision makers, with the renommee that the ECDC has in Europe. I definitely would recommend to ask for help. At least that would be one main pillar of collaboration, right? In what circumstances, at least similar as ours were. So if they lack any human resources or experience in the area that they want to cover or maybe analyze or manage even, because I think that ECDC has experience as well as sufficient networks where maybe people or pools of professionals where they can choose from to then help other member states in any types of challenges or issues that they may encounter, to be motivated to ask for help.